I'm Dr. C Jagadeesh, Chief Orthopedic Surgeon and Director of Robotic Surgery, Bandarghatta Road, Asra Hospitals. Post-surgery, the rehabilitation is very important. If we do a good surgery also, rehabilitations, if they don't do properly, it won't give 100%. We recommend that after the surgery, they have to do a rehabilitation exercises properly. So to get back to their normal activities, so that their much deformities or their problem what they were facing before the surgery should go completely. Importance of the physiotherapy lies in that only. So we would recommend from the beginning they should start taking the simple exercises, and then what are all the day-to-day activities they are doing it at home should be carried on with the rehabilitation people or with the physiotherapist help. Sometimes even the people at home can also help them in getting back to the normal activities earlier.